I've never had to help a client purchase a long-term care policy to cover the full cost of staying in a long-term care unit, because typically you have some type of a pension or Social Security, and then you have your portfolio, which puts off income. And so you're only insuring the gap.
Exactly.
Right.
Yes.
And the cost of long-term care is going up about 2% per year.
Mm-hmm.
So you can typically solve it between a $2,000 to $4,000 monthly benefit. And then if you're younger, you just add the 2% inflation rider to the policy.
Exactly.
And it works. And then our software is able to show you, this is where you are. I joke with people. I say, it's like the old Nancy Reagan drug campaign from when we were kids. You know, this is your brain on drugs. It's like, this is your portfolio. This is your portfolio in a nursing home.
Sure.
Welcome to Wiser Retirement Podcast. We believe the best financial advice should always be conflict-free. I'm your host, Casey Smith. Guiding you to financial freedom today is my co-host, Logan Steele from Steele Choice Insurance. Hi, Logan.
Hey, Casey. How are you?
This is what, trip number, 4 or 5 for you on the podcast?
I think it's 3.
Trip number 3.
Yeah.
Welcome back.
Thanks for having me back. Yeah. Appreciate it.
So today we're going to talk about medical costs during retirement and preparing for the unexpected. And you know, it sounds like a boring topic, but it's actually very interesting because people don't really pay attention to this stuff until 64 and a half. And then they go, oh yeah, when I go to this Medicare or when I leave my employer, this medical stuff is going to be expensive and it's going to be a really bad insurance. And I'm like, actually, no, it's actually not a bad deal. I mean, that's partially why, politically, so many people want Medicare for all, right?
Right. Right. Absolutely. And that's, I think, still on the table there. We'll see this next legislation, but,
well, when we do financial planning for like a 25-year-old, 30-year-old, and you project out today's healthcare costs at 5.3% inflation, right. There's going to have to be a change because your medical costs are hundreds of thousands of dollars. That's just the premiums.
Right. Yep. It's unsustainable. Yeah. When your healthcare inflation is 2.5 times what it is, everything else out there.
Yeah.
Absolutely.
Definitely a problem, but that's not what today's about. Today's about you're approaching retirement.
Right.
And you know, what do we need to be doing? Obviously we're going to sign up for Medicare. We're going to pick a supplemental plan, but, in fact, is the system worse than the corporate insurance, or is it better than corporate insurance?
Yeah. So I think what people are, like you said, kind of concerned about, but surprised about in a positive way is coming from a corporate plan. They're used to a PPO plan. The employer's paying, say, 70-75% of the plan. They have dental, they have vision. You know, they might have, $100 to $300 per month coming out of their monthly check. Mm-hmm. I'm going to Medicare. I'm going to lose all my doctors. I see all these things when I look online that say that doctors are dropping out of Medicare, that they're not going to be covering that. So there's a lot of scare tactics out there. There really are. So really a lot of my time is spent just kind of comforting folks and say, hey, you got some great options when you're going to Medicare. Now, Medicare, of course, is at 65. So, if somebody's retiring earlier than that, then, there's going to be some other things we can talk through. But if we talk about just Medicare, when they move to Medicare, whether it be a Medicare Supplement or Medicare Advantage, what they'll find is generally a much higher level of coverage than which they had through their employer. So we're talking about deductibles from, $0 to usually $240. Chances are that's much lower than their current deductible.
Right.
The access to care that you're going to have on Medicare is going to be usually as great, if not greater. Somebody goes with Medicare Supplement, as long as that provider takes Medicare, which most of them do, you're going to have some that are dropping out. But, living, especially in a metropolitan area like Atlanta and Marietta area, you're not going to have a problem finding a provider. All the major hospital systems, of course, are going to be in network with Medicare and accept Medicare reimbursement rates. So they'll be fine with any Medicare Supplement as well. So Medicare Supplements, again, have 0 networks, right? So as long as that provider takes Medicare, they're going to take the Medicare Supplement plan. So access to care and then cost of care. So cost of care, when you're on Medicare, you have that $240 deductible. That's what it is this year under Medicare Part B. And if you have a Plan G Medicare supplement, that covers 100% of the rest. So if somebody's concerned about hospitalization, surgeries, major imaging, CAT scans, MRIs, number of doctor's visits, their costs are very minimal, especially compared likely to their corporate plan that they have now, or even if they're on a individual health insurance plan. Prescription's a bit of a different category. So we could probably do like a whole podcast just on prescription drug,
right?
Because it's very complicated and it's a major part of, healthcare costs for seniors. It's going to be higher than what is going to be for medical cost. So that is changing. We have new legislation that was signed, last year, the Inflation Reduction Act. So that actually capped the cost of covered medications under Part D, which is for prescription drugs for people on Medicare, to $8,000 this year. We've never had a cap on prescription drugs for people on Medicare since Medicare started in 1965.
So that means the max you can spend on drugs is $8,000. Above that, it's covered?
Above that, it's covered at 100%.
Okay.
We had a catastrophic level before that. So this past year, you would pay 5%. So, nearly covered, 95% covered. But this year it's capped at the 8,000. Now it does have to be listed as a covered formulary medication. So it's got to be covered under the plan, right? So not all prescription drug plans are going to be, built exactly the same. They need to look up their medications, and it's a lot of what kind of I do on my side is we'll look up medications and see which plan is going to be best. But for those plans that cover that medication, you're capped at the 8,000 amount. And that's scheduled to go down to 2,000 next year.
So insulin's always been a big expense for people. Does that fall under?
It'll fall under there. So you have the insulin savings program that was signed a couple of years ago. So, that caps covered insulin at $35. So that was a big savings for folks that are diabetic and taking insulin. But that'll be included there as well if it's under Part D. There are some medications under Part B, but for the most part, the sake of this conversation,
can you sign up for Part D after the fact? So if you're 70 years old, can you go back and get Part D? Is that a one-time election?
So usually people would sign up like right when they're retiring, for Part D. Some people do delay it. It's not something advisable in my opinion, because you're paying a compounding penalty for each month that you go without prescription drug coverage. There is a late enrollment penalty. Some people do that kind of to avoid the IRMA, which we've talked about on here a lot.
Yeah.
And for, some seniors, if they're going to be higher income, higher net worth, and they're going to be paying quite a bit more for their Medicare. Granted, it's probably going to be a smaller percentage of their overall pay.
Exactly.
But from that aspect, some of those people choose to go without prescription drug coverage for that period of time. But again, I wouldn't advise that. But you can get it later on. Yes, to answer your question, it would just have to be during that open enrollment period to do so, or if somebody had a loss of coverage. Because honestly, I work with a lot of people that are, say, retiring at age 70, they've carried their corporate plan. We'll do that analysis. And I've done that with several of your clients. Does it make sense to go ahead and take Medicare at 65, or does it make sense to stay on my company's plan? And it's like everything else. It depends.
It depends. Right.
Yeah.
Every family or every situation is unique. Right.
Right. But just to go back to overall, again, concerns for people, most people are going to find that they're going to receive a higher level of care of insurance under Medicare at a lower cost than what they have now. And it's yet to be seen kind of, how that's going to work with prescription drugs. That's kind of the big elephant in the room at this point. How is that, when you're putting a cap of $2,000, how is that going to affect the drug plans next year?
Yeah, true.
I don't know. We'll see. But there's going to have to be some, major changes there. And it's going to be a shared cost the way the bill is written. So, majority of that reduction or that cost is going to be absorbed by the manufacturer, but part of that is going to be by the plan. Part of that is going to be subsidized. So, it's going to be some tweaks over the next few years. I have a feeling.
So it sounds like we shouldn't have any fear in transitioning to Medicare because it's a lesser coverage. It sounds like in many cases financially, it's a kind of a win-win. But what about we have Medigap, and then we have the supplement, right? So Plan G, that's a supplement plan.
That's a supplement plan, right?
Okay.
So 65-year-old in Marietta, they should expect to spend, $135 to $150 a month on
for Plan G.
Yeah, for Plan G. That's going to go up maybe
in addition to the $175 you pay
for Part B.
For Part B. So you're looking at $300 a month.
You're looking
as a small business owner, I will take that.
Exactly. Yeah, exactly. $300 a month for a great plan,
right.
For an excellent plan.
We have really good healthcare here, but we're spending.
It's more than $300.
Yes.
Yeah. Yeah. And Medicare is quite a bit better than what you can get for a small business,
right?
Unless
absolutely.
you're spending $4,000 a month for an employee. So
right.
That really makes sense. Yeah, so they'll find a nice benefit at a low cost. Now, Medicare Part B and Plan G premiums are going to be going up each year. Kind of figure 10%, give or take, on an annual basis. Prescription drug costs are going to be going up each year. So, as most seniors of that total cost they're going to be spending on healthcare expenses over the course of the years is really going to be weighted in their later years.
Right.
Mm-hmm.
Right.
Yeah.
Well, in our planning, obviously we have all the tables for Medicare, and then the supplemental plans or the Medigap plan, and then our Advantage and Medigap, and then we also budget about $1,800 a year per person for out of pocket expenses. And some people go, "Oh, that seems kind of low," and actually it seems because you don't have as much out of pocket when you're on the Medicare program. It seems to be a realistic number. There was a study that we found in preparation for this by the Health and Retirement. It's called the Health and Retirement Study. I assume this is done by the government, but the people that pulled this out, basically, out of pocket, what are we expecting? And between $2,000 and $5,000, an increase in cost. So you have your normal cost. This is not your total healthcare cost, but you just have your normal cost. The surprise of, hey, we have bigger healthcare expenses for 65 and older. Only 10.9% of participants, which should be everybody, pretty much every U.S. citizen anyway, was between $2,000 and $5,000.
Yep. So
10% of the entire population over the age of 65 had out of pocket or an increase in their normal health care from $2,000 to $5,000. That was in 2022 that they did the study, but it's the 2012 to 2018 years. So it's from 2012 to 2018 is when the actual data is.
Sure.
And then 5.8% had an increase of $5,000 to $10,000. 3.3% of Medicare participants from 10 to 25,000. You kind of wonder in there if they aren't doing something that's just not covered,
right?
They're doing some type of a care that's not.
Yeah, that would
like
be
the holistic health kind of stuff,
likely two main categories for those individuals. And I don't know if they're including like long-term care into that. Likely
they're not.
Okay.
No, there's no long-term care. In fact, that's a good question.
So prescriptions and dental. I mean, you'd be surprised. I mean, dental is going to be more than what most people.
Oh, I'm sorry. You know what? They do.
Oh, they do. Okay.
So here's what's included: hospital stays, nursing home stays, doctor visits, dental services, outpatient surgery, and prescription drugs.
Okay.
Are all the things that were covered in the study, and home health care, which is kind of in the nursing home category.
Yeah. So that's going to be where your bigger expenses certainly are going to be.
Adult daycare, physical therapy, social worker, transportation for elderly.
Right.
And then they have another category. So yeah, anything related to health is what's covered. 2% over 25,000.
Got it. Yeah. So that 25,000. Yeah. I mean, that could be on dental, that could be on long-term care, could be on prescriptions right now, which, again, like we talked about, prescriptions are going to go down. I mean, the average cost, we can go through some good statistics. I brought some. So average cost is around $2,700, according to the Congressional Budget Office. That's for prescription drug cost for the average senior that's on Medicare, 2,700. So there's, going to be kind of a big range in there. But if you figure that on the average it's 2,700 and that it's going to be capped at 2,000 next year,
right?
I mean, that's a major, major change.
Yeah.
So, and then total, there's a bunch of studies out there to look at the total healthcare costs, taking out long-term care and then, including long-term care, how that's going to look over the course of, an individual or a couple's life from when they retired age 65 through their lifetime. And that number for 2023 numbers, this was at $315,000 as a total amount for a couple.
Yeah.
On average.
Yeah.
Now that's not including long-term care. It's not including nursing home or assisted living, but $315,000 is basically what to budget there. So that's looking at Medicare premiums, prescription, dental, medical cost over that senior's lifetime. Once we add in long-term care, and we can talk about this, and I have some good numbers we can share here, you're looking at double that, $662,000 for a couple.
Mm-hmm.
Now, for long-term care, it's about 70% of people will end up needing long-term care if they are at least 65 now.
Right.
Right. So it's a good chunk of Americans, and most people don't have long-term care insurance. Some people that think that Medicare covers long-term care. It does not.
Are you curious why annuities keep coming up as a potential investment option? People are often told that annuities can effectively mitigate investment risks and help secure their financial future. However, annuities often benefit the salesperson and might not be the best choice for you as a consumer. To learn more about the various types of annuities, the negatives of owning them, and better investment alternatives, we have a free ebook on our website just for you. To download our ebook, Buyer Beware, Why Do They Keep Trying to Sell You That Annuity? Simply click the link in the episode notes or visit wiserinvestor.com/guides. Now let's get back to the episode.
I just did wrapped up some planning with the families in Minnesota, and we struggled with how to solve the long-term care piece because I'm looking at my screen going, this doesn't look normal. And so we ended up just kind of punting and scheduling a fourth meeting. Okay, we don't know what's happening here. Well, I'm thinking we entered something wrong or something's going on. And so we get online with Randy. He's our long-term care guy, and I'm showing him my screen, and we've realized the cost in Minnesota is double what it costs in Georgia. Literally double. It's like $89,000 for nursing home here in Georgia, but it's double that. It was over $170,000.
Mm-hmm.
That was on our table. His table showed $139,000 would be the average nursing home stay in Minnesota. Yeah. Then you start looking at other states.
It's a big difference.
It's a big
difference. I actually brought that list, but between states, and Georgia is on the lower side.
Yes.
So
I was very surprised by that.
I don't want to put you in a spot, but what would you guess for Georgia? This is 2023 numbers for assisted living. So
assisted living, probably 45,000.
Right. Boom. You're on it. So
see stuff every day.
4,300. Yep. That's the average in Georgia. But if you were to go to, you have a lot of clients that are looking to go to down to Florida.
Oh yeah.
You're bumping another $1,200, an extra $1,000 a month.
Yeah. Down in Florida. I can see that.
So that's an extra 20, 25%.
Florida's also a little complicated because they have a lot of what they call CCRCs.
Mm-hmm.
So you pay to get in.
Yeah.
You pay $150,000.
Right. The initiation fee. Right.
Yeah. I think
and you're starting to see some of that here too.
Yes. Yeah. But one side of the one side, not the building, but the property is people coming and going as they please. And then the far other side of the people who can't leave the bed. So it's continuous care, right? Is the whole idea.
Continuous care. Absolutely.
What I find is that those places tend to be really good at one thing, but not good at all things.
Yeah.
So sometimes they still, after paying all those entry fees, they still end up going somewhere else.
I've heard similar stories. Fees. Yeah.
But yeah, what's Washington? Is Washington around 160 for nursing home, or is that just do you just have
Washington? So Washington,
independent living,
quite a bit more. So assisted living in Washington, $6,700
per month.
per month. Yeah. So $80,000 a year for assisted living.
Nursing home.
Nursing home, you're at 10,200, so 122,000 for that's for a semi-private room. You want a private room, you're up to 140,000.
Yeah. So that's one of the states where they mandate you carry long-term care. Mm-hmm. So it's kind of becoming like a blue versus red thing. There aren't too many red states that have mandatory long-term care. That means if you're 25 years old, you got to be carrying like at least a 1 year long-term care policy. Everybody has to do it. So it's not a bad idea, but what we see is, for whatever reason, the states that are mandating it, just before they mandate it, the costs keep going up. So I thought that's strange, and I don't know how to resolve that in my head. Like, how can the government make the costs go up other than fees, regulation? I don't know. But they all of a sudden the costs go way up, and then the government says, okay, everyone has to have a policy now. And but in the states where they're not even thinking about mandating it, the cost is lower.
Yep. Yeah.
So it's really strange. But like, okay, so we can take a side. We have lots of podcasts on long-term care insurance, but we can take a side note here and just say, I've never had to help a client purchase a long-term care policy to cover the full cost of staying in a long-term care unit. Because typically you have some type of a pension or Social Security, and then you have your portfolio, which puts off income. And so you're only insuring the gap.
Exactly.
Right?
Yes.
And the cost of long-term care is going up about 2% per year. Mm-hmm. So you can typically solve it between a $2,000 to $4,000 monthly benefit. And then if you're younger, you just add the 2% inflation rider to the policy.
Exactly.
And it works. And then our software is able to show you, this is where you are. I joke with people. I say, it's like the old Nancy Reagan drug campaign from when we were kids. This is your brain. This is your brain on drugs. It's like, this is your portfolio. This is your portfolio in a nursing home.
Sure.
Right.
Yeah.
And it shows
that's a great way to explain it.
So it'll show you what the drawdown is.
Sure.
In a nursing home, and then you overlay the new policy on top of it, and it'll show you what how much more money you would have by having this policy. And then this is the part that insurance agents don't show you, is I show them, this is what the difference is between keeping that money invested versus pulling it out of the portfolio. Right. And sometimes the cost is, well, it's better just staying in the portfolio to cover it. And so you can kind of self-insure it. And then in some cases it doesn't work that way. And that's what I was stuck on in the Minnesota situation. Cause like, holy crap, I can't solve this thing. This is a very wealthy client. And we ended up backing into, they needed a policy of about $7,500 a month in today's dollars. Cause if they're 57 today, which is the time you should be buying it, we're not really assuming you're going to use it tomorrow. We're assuming you're going to use it at around age 80.
Right.
And, so anyway, if protecting your assets is important to you and passing that on to the next generation, you're going to have some type of a long-term care policy to help ensure that.
Exactly. Yeah. No,
now if you're okay with going to zero and leave them with nothing,
right.
And you're okay with potentially going on state care,
which
is not
self-insured,
which is not the end of the world.
It's not the end of the world, but there is a very big difference between going to a nursing home that's $4,000 a month versus $12,000 a month. I've been in those $2,000 a month places. And
it's sad, isn't it?
It's sad, unfortunately. Yeah. It is. But no, I 100% agree with what you're saying, and that's how I usually advise most of my clients. I don't specialize in long-term care, but it is, part of my business. And having it as a supplemental to their self-insurance aspect it really makes the most amount of sense for most folks. But, long-term care is not what it used to be either. 20 years ago, you could get an excellent plan. It would pay unlimited amounts and you're paying, $100, $200 a month. Some people were locking in those premiums.
But companies lost so much money.
They lost a ton of money.
And they lost
a ton of money.
There was a family, husband and wife have passed away now, but they had a CNA policy, which they got out of long-term care like decades ago. Mm-hmm. And CNA found every reason not to pay it. Oh yeah. It's like, we got one denied one time because the same nurse, it was in-home care. Same nurse just signed it slightly different. Like her signature was a little different. So they denied it because the signature did not look the same as prior signatures.
Unbelievable.
And I was like,
Wow.
good grief. This is tough.
That's tough. Yeah.
No, eventually it was approved, but
Sure.
they look for every reason not to pay.
Yeah.
The newer policies don't seem to be that way at all. And that's because they've built them where they're profitable for the company now, or perceived to be.
Right. Yeah. And those premiums are going up each year. You're getting that notice saying, which one do you want, a higher premium or a lower benefit?
That's right. And you can pay not to get it, to have a guaranteed premium. There's also hybrid policies where you can basically pay for 10 or 20 years and then you're just paid up. Those are more expensive, but if you die, you get,
it would have a death benefit.
Gets a death benefit. So in most cases, most of your premium goes back to the beneficiaries if you never use the policy. But again, that's a whole separate podcast on long-term care. So is it safe to say that you think that it would be more of a long-term care scenario is better to be planning to hedge versus your actual healthcare cost on Medicare?
Yeah, absolutely. I think for most people, that is going to be the best way to go is to hedge their cost on it. You just look at the statistics, like you said. So 70% of people are, expecting to need long-term care at some point in their life. Now, if you have a plan for it, which most people don't, but if they're sitting down with you, they do have a plan to potentially self-insure. And if that lines up with their needs, absolutely. But most people don't have a plan for it. You don't have a plan for it, then one way to easily get a plan for it is with a policy. And there's a bunch of different ways to skin it. So it needs to be something that's affordable. But for people that are purchasing it, they should have the understanding that the plan is not going to pay 100% of what they might end up needing it for.
Right.
So they can't rely fully on the policy for that.
But you have so much lost money if you're insuring it.
I get it.
I've eliminated a few sales people in conversations very quickly when they said, "Oh, they should just go ahead and get a policy for $12,000 a month, and this will fully cover it." And then you look at the premiums, you're like, they're going to give up a vacation a year to pay this premium.
I know.
That's crazy.
Yeah, and you have to look at your own situation too. What is your family health situation? What kind of health are you currently? And it can be difficult to get a long-term care policy. So even for people that it's a great fit for them, or they financially is a great fit for them, they just may not be eligible for it. So there's a lot of people now that are getting it in their 40s. Ideally you wait till your 50s and try to delay that as long as possible. Right. But I mean, honestly, it's probably close to almost half of the people that I talk to that are looking in their 50s and 60s that they don't qualify. Yeah. Because I mean, if they're medically. BMI on a medical side. Yeah. Because, we're looking at really the top carriers. Now you can get in certain kind of compromise plans that have a lot of exclusions. And at that point, no, it's just, try to self-insure if you can. But it can be kind of difficult. And, somebody takes a lot of medications, if their BMI is high, if they've had a heart attack in the last 5 or 10 years, if they've dealt with cancer before, with a lot of carriers, that's going to be automatic exclusion. Otherwise, it's going to be a tiered rating, so that rate's going to be higher. Yeah, right.
And long-term care can be built on different platforms. There's actually long-term care annuities, which we've used one time in 24 years here, and that was with a person who had triple bypass. Nobody would cover them, but annuity doesn't have that type of.
That's true. Yeah, it's not going to have that same restriction.
Same restriction. There's ones built on whole life, and then there's just traditional buying a policy. I think for more wealthier clients, it makes sense just to write a check one time for a paid up policy. That's a hybrid policy, knowing that you get that money back or a little bit more if you don't use the policy. Then it hedges the cost of the long-term care expense.
Sure. There can be some tax benefits there to do a qualified plan.
Yes,
and
true. Very true.
But you're right. That's a whole different podcast. And there's a bunch of different ways to skin that. But knowing what the potential exposure is, I think, will certainly help individuals kind of make that determination on what it's going to be. And, it's something between men and women too. So women are going to be living longer, which means they're more likely to be in long-term care for a longer period of time. Right. So you're looking at longevity. So it might be something where you're speaking with a couple and perhaps it's just the the wife that's receiving long-term care, and the husband chooses to self-insure, as an example.
Yeah.
Yeah.
There's ways to mitigate healthcare costs. Unfortunately, it requires staying healthy, which is not as fun.
Yeah.
It is for some people. Some people love working out and exercise and kind of make it their passion, but I am not that person. I have to have the podcast on when I'm on the elliptical or something to distract me from the fact that I'm actually working out. Right.
Yeah. Well, I mean, honestly, that's probably, one of the biggest controls you have on your healthcare expenses
is staying healthy,
staying
out of the system,
staying out of the system. That's right.
I get, we just hear horror stories, even this like, I struggle because you have Wellstar here in Marietta, which is right in our back door. Then you have Piedmont, which is down in Atlanta, and then you have Northside Hospital, which is, I guess,
Northside and Emory. Yeah, those are 4 big ones. Yep.
So, I sit in a very unique position, and I get to see all these families that are way older than me, or I'm getting closer to them, it seems like. But the point is that quality of care, like I say this publicly all the time. I would not go to a Wellstar facility. Piedmont has all the money, but I still see clients who've had issues, misdiagnosis down there. Northside seems to have it together, but then I hear people complain about that too. And so then I come all the way back to full circle saying the best thing to do is stay out of the system.
Stay out of the system. And really, I mean, all 4 of those hospital systems, they're going to have specialists that are going to be, some of the top in their field. But I understand what you're saying, and it certainly can be easy to paint a broad brush. And I speak with clients about all of the different hospital systems, and there's a lot of positives to say and a lot of negatives to say about each one. So it's just that each individual situation. But yeah, Piedmont for heart, they have a great, heart institute. You got Emory for the cancer wind shape center, which is excellent. Yeah, Northside kind of does it all, baby factory and everything else. Right. But yeah. You're right. I'm curious because I've heard more clients that are now going outside of the United States for care. Do you ever have that conversation with clients?
I haven't. I've had a few that have threatened to say, well, we're thinking about doing this because I can get this procedure in Mexico and it's temporary or it's not approved here or something like that. But no, I haven't. I had someone that went out to Arizona. Would that be the Mayo Clinic maybe? Out in Arizona, that have done that, but no, for the most part, I think everyone has stayed pretty local.
I'm having more clients that are telling me that prescriptions in the category of dental, that they're going outside of the United States for it.
Interesting.
So yeah, you're seeing a lot more.
Wait a minute, why dental? That seems really easy.
Yeah, you would think, but I mean, some of these dental procedures, somebody needs multiple crowns or veneers or implants.
It's all cost,
for the cost,
not quality of care.
I mean, many are claiming that they can receive comparable quality of care at a far drastically reduced premium. So you have this kind of whole area of medical tourism where people are going down to Costa Rica or, going to Japan or whatever.
They come back with gold teeth.
Yeah. I talked to a client yesterday and they go over to Japan to China every year.
China.
I know.
It costs you like $8,000 to get there.
Yeah. They go over there, they see family, they get their dental work done. Okay. They save a few $1,000s on their dental.
Well, they're seeing family. They're going to see family and their idea of fun is get some dental work while they're there.
Costa Rica is a big one. A lot of people just go down to Costa Rica.
You have a lot of expats there anyway.
Yeah. You can hop down there in 2 hours and, not a very expensive plane ticket down there. But yeah, you're saving quite a bit by doing it. Medications is a big one too. I mean, you're seeing far more international pharmacies are popping up that give very easy access for Americans to do. So Canada, India, those are really kind of the 2 main ones. But I have a lot of clients, for example, that take Eliquis. Eliquis is one of those medication you probably saw that's on that top 10 list that Medicare is going to start negotiating. That's going to go into effect in 2026. But it's a crazy number. It's like between what beneficiaries are spending and what the plans are spending and what Medicare subsidizes is over $16.5 billion when they did the study. That was between, I want to say like June 2022 to last year. So 12-month period, $16.5 billion for one medication. Yeah. Yeah. So
Good thing they're printing money.
they're just printing money. Yeah. But I have clients that get it from India for $50 a month.
Oh, wow.
Yeah. Now, whether it's the exact same ingredients, I don't know.
I was
There's,
about to say,
yeah. Again, it's not something I endorse them doing, but I'm
Right.
saying people are moving towards those
moving
efforts.
that way. But
Yes.
are they having it shipped here and calling it something else? Or they're like just hopping on a plane and going to India?
No, they're having it shipped here. Yeah.
And that's legal?
Mm-hmm. They're able to get it. Yep.
Interesting.
Yeah. 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 You're seeing a lot of it, and you're starting to see it even on like a group basis now as well. So, some groups are using like international pharmacies. So again, I mean, prescription is I talked about it a lot, but it's a big portion of it. It's one of the biggest problems that we have in our healthcare system right now. Right. And it is actively being addressed. It's just a matter of, is it going to actually work or not?
Yeah. Well, it sounds expensive if we're basically be subsidizing all that, not
right.
the India part, but just the
right.
the real cost of those drugs. And then we're the max out of pocket said it was going to be $2,000 for.
Yeah. $2,000 next year.
Yeah.
So
in 2025.
In 2025.
Yeah.
Correct.
Okay.
Yeah. And then 2026 is when they're going to be able to, Medicare is going to start implementing the negotiation practices on at least those first 10 medications.
Okay.
Yeah.
So when did all this start? Like when was this the prior administration or is it the current administration that's doing this?
Well, you had the Inflation Reduction Act that was under Biden. So yeah, that's the majority of it. Yes. Okay. That's the majority of it. But yeah, the insulin savings program, which is a portion of it's a separate bill, but yeah, that was back previous administration. So, I mean, it's really somewhat of a bipartisan issue. I mean, both sides are kind of on board with it.
There's a lot of bipartisan issues actually that don't get enough credit.
Right.
But we're just not the world we live in right now, unfortunately.
It's not. Yeah, it's not. But, it's when it comes to Medicare, Social Security, it's the third rail.
Yeah, right.
No politician wants to touch either of those. So
No.
I don't see those going away.
No, that's another thing is actually I'm doing a little video on that after our show today, talking about Social Security and what happens when the trust fund runs out, and
right,
yeah, it kind of falls right in line with all the Medicare stuff too.
Sure.
Okay, so I think what we've learned here is Medicare is not scary. Actually, it's a really good plan. And,
it works. Yeah, it works.
This is why they want Medicare for all. Some people call it universal health care, but to get it 65, you can't get Medicare earlier if you're disabled.
You can,
right?
Yep. Yeah. So, disabled, Social Security disability after 2 years. Yeah. Medicare kicks in. So, and those individuals would be eligible for all the same benefits that, someone over age 65, except for Medicare supplement premiums are a lot more expensive
when you're under 65.
When you're under age 65. Yeah. And it's a little bit different state by state. So most of those people go with Medicare Advantage, which is fine. I mean, usually that's financially makes sense versus paying $1,200, $1,300 a month for a Medicare supplement premium.
Right.
Mm-hmm.
Well, Logan, how do our clients find you other than calling us?
Sure. Yeah, absolutely. They can go to my website, steelechoice.com. I have my phone number, of course, on there, email address. They can schedule a call, a 30-minute consultation, go through their questions. So, yeah, happy to help out in any way I can.
Well, you've been a great help to the client base already, so we appreciate that. You're always very prompt with emails and phone calls, and that's huge in this business. It's really hard to find people that return phone calls and emails. Like, I don't understand it.
I try to be, not perfect, but to do my best. I understand.
All right. Well,
appreciate it.
Thanks for your time today. If you want to keep listening more on this topic, we have episode 179. You can go back to, this is episode 212, which is crazy. 212 times we've done this.
Awesome.
Episode 179, long-term care insurance, to buy or not to buy. Pretty sure that was with Randy. Episode 188, current state of healthcare and Medicare open enrollment. I think that was one of ours that we did. We also have a YouTube video. We referenced IRMA earlier. If you want to learn what IRMA means, you can find that on the YouTube channel, A Wiser Retirement. Linked also in the show notes here. We also linked to Logan's website, Steele Choice Insurance, that you can find there as well. Thanks for listening to today's episode. If you're interested in learning more about Wiser Wealth Management or want to schedule a consultation to meet with one of our fiduciary financial advisors, you can do so by going to wiserinvestor.com, or you can click on the link in the episode notes. We'll see you guys next week.
Thanks for listening to a Wiser Retirement podcast. We hope you enjoyed today's episode. Make sure to subscribe wherever you're listening. That way you don't miss any new episodes. We'd also appreciate if you could leave a rating and review. If you have any questions about anything that was discussed today, head to wiserinvestor.com and reach out.
This episode was produced by Edward Resendez.